COVID-19 now as we enter what I think may be a different phase of the coronavirus pandemic. In many countries in the world, you can go into a pharmacy and get a home testing kit for COVID-19. In other words, you can test yourself for the virus at home. But insofar as I know, you can't actually do that as a normal person in this country. Dr. Dimakatso Mathibe is the Senior Manager for Medical Devices at the SA Health Products Regulatory Authority. Dr. Mathibe, good afternoon to you and thank you for your time. What is the story? Can you get a home testing kit for COVID-19 in South Africa?
At the current moment, you cannot get the home test kit as yet, but we have approved and put specifications and requirements on our website for any organizations that have interest to applying to be able to sell self-test kit in the market.
Why can't you get one in South Africa?
No, you have to apply to SAHPRA, Regulatory Authority. We will review your application, and as I indicated, we have put it on our website, the requirements on what you need to submit for us to review and approve the self-test kit. So we have so far received a number of applications that we are currently reviewing. So once we have approved, then it will be available. If they comply to the requirements, then they will be available.
Are you suggesting that the problem is really on the supply side? People didn't apply earlier, they haven't actually got in touch earlier saying they want to do this, therefore you haven't had anything to test? We
have published the requirements beginning of March, and as I indicated, it's a process. Once we have received a number of applications from various applicants, and as I have indicated, we are currently reviewing that, and once we have reviewed and we are happy with what is submitted and it complies to the specifications that we have published, then we will approve that.
How long does the process take?
It depends. The timeline that we've put it is 10 weeks, but it depends on what we are receiving as well from the applicants.
When it comes to issues around vaccines and other medicines, often our authorities in SAHPRA and other bodies will look at the data from other countries. What that would mean is that often you will look at that data, you will do your own testing, of course, but you will look at that data. Are you going to do the same here? And I say this because these tests are widely available in many other places.
Yeah, definitely. That's exactly what we're doing. We're using the same kind of approach, yes.
Okay, so the chances are then, you can't say this, but I can, probably in 10 weeks you'll legalize them. You'll allow them to be sold here.
We are not legalizing. We'll approve it to be sold in the market.
Okay. If someone goes overseas right now, say they go to, I don't know, Rotterdam or somewhere, and they come home with 100 of these kits, are they allowed to use them here?
No, you cannot import a self-test kit that is not yet approved by the regulatory. And I just need to indicate that the reason why we want to ensure that the test kits that are in our market are safe and they're performing as intended is because with the start of COVID, there was a lot of healthcare professional test kit that was of substandard and also that was falsified. So it's our responsibility as an authority to ensure that the same will have to apply for the self-test kit with the healthcare professional, because we do have a list of healthcare professionals that is on our website. And once we've started approving the self-test kit, then we will also publish. But it's our responsibility to make sure that the product that is in the market are safe and are of quality and they're performing as intended by the manufacturer.
Dr. Dimakatso Mathibe, thank you very much indeed. 10 weeks from now or so, we should find out. Dr. Mathibe is the Senior Manager for Medical Devices at the SA Health Products Regulatory Authority.